And one of the comments that you had on your website was, if you're not happy where you're at, take action. Now that goes for both patient and medical practitioner. So can I ask you to unpack both, please?
Correct. Yes, it goes for both. And especially, this is a very tricky, I don't know if I can call it a comfort zone, where a lot of times patients have a health professional and there's certain things they don't like about their sessions or their meetings, and then they go, oh, but he's a very good person, or she's a very good whatever. Like there is one good characteristic that they have, but a few things that bother them, and they get stuck into this corner of, okay, yes, I have this, but that, and they stay and they mingle in that for so long, and there's no progress.
Yeah.
So it's okay, and try to share that with your profession, your health professional, if something is bothering you. Or, it's okay to say, I have this issue. I'm happy that I have this issue, and I would like to talk about it.
Yeah.
It's
that question and that statement in itself, yes, you might need to be a bit brave to say it, but doesn't that unlock doors? It's still, as long as the conversation's there, it's unlocking further opportunities. But as humans, it can be so very, very easy to sit in that accepting and justifying, and it's okay. But you don't realize how long you sit there and how long you actually are staying in that place where, and you use the word no progress, you get stuck in a no progress zone through that accepting. So again, it's just bringing up those next things to have a different conversation. If a patient's had that and then it's still not moving forward, then what can they do next?
They can come to me, obviously. Keep trying, because every obstacle in communication is an obstacle in disease management.
Oh, well said. Can you repeat that, please?
Yes.
Yes, please.
Every obstacle in communication is an obstacle in disease management, whether you are a patient or a health professional.
Yeah.
So, you really want to connect with your patients, with your clients, and you want to connect with your health professional. They have to be your confidant, and be able to express whatever it is that they need to express. It's for everybody's best.
That's interesting. Yeah, beautiful. So on the note of coming back to that, if you're not happy where you are, take action. So if somebody's in I'll call it a practice, so we're sort of moving more to the practitioners now, and they themselves may not be happy, obviously they can attend your workshops as an individual, and you can obviously do clinic type workshops as well. But if somebody's going to be the change maker in a practice and they want to, how can they get started, and how can they then create the change not only for themselves but across the practice? So
across the practice? Well, first of all, if they are interested in this field, because in healthcare settings, a lot of times there's teams. And I always tell them, if you yourself are not interested in this thing of communicating with your patients, have somebody in the team that does. It's very important. If you want to be the game changer, you can do it. I mean, you can attend a workshop and then try to translate that to your patients, and word travels fast. So if you start making a change with your own patients, and other health professionals start, oh wow, so how did you do that? Or you discover something about a patient that's been there for years, and all of a sudden you discover something that you should have known years back, but it never really popped out in a conversation for some reason.
Yeah.
Yes, and then everybody gets interested in, wow, so how did you get that piece of information? How did it happen that he said that or that she said that? And this is like giving a bait to the rest of the team and putting them in this game.
Yeah, yeah, very much so. No, that's thank you for sharing that. So, how can people find out about your workshops and connect with you and those sorts of things as well? Just so we make sure we capture that today because we're having such a great conversation.
Well, first stop would be my website,
Yeah,
where I explain everything about my work, the one-to-one and the workshops that I offer. I'm also on LinkedIn, as you know, my website is my name, despinavaraclas.com, and LinkedIn as Despina Varaclas, and also on Facebook. But LinkedIn is basically the main platform I work, the LinkedIn and the website.
yeah.